On the last video, we spoke about neonatal hypoglycemia and the importance of calculating glucose delivery before you increase the patient from the previous maintenance that he was on. So I'll just make a quick video to tell you how we go about calculating that glucose delivery. Welcome to PaedsCrib, where we guide young minds to heal young lives through case-based discussions. I am Dr. Manyesane, a pediatrician based in East London. If you find value in our content, don't forget to subscribe, like, and share with peers. And make sure you hit the bell notification so you never miss an update. Let's dive in and grow together. Okay, so just to recap on some of the important things we discussed on the last video, the normal glucose delivery for a term neonate is between 4 to 6 milligrams per kg per minute. And for a preterm neonate, it is 6 to 8 milligrams per kg per minute. And the maximum for the two is 10 milligrams per kg per minute, especially if you're dealing with children with a risk of hypoglycemia, like your preterm babies, infant of a diabetic mother, septic neonates, etc. It is also important to note that if you need to maximize your glucose delivery, you might actually need to concentrate the maintenance or the fluids that you are actually giving to reach that maximum glucose delivery, especially if you want to avoid fluid overload. You don't want to go to a higher total intake, so you might need to concentrate what you are already giving so that you give a small volume but a highly concentrated fluid. So in a case where you need to give more than 12.5% solution, where you have concentrated your 10% neolite to a 12.5% solution or more than that, then you might need to use a UVC or some form of a central line. But if you're using anything, you're giving anything that is less than 12.5%, you can go ahead and use your peripheral line. The first question to ask yourself when you're going to calculate a glucose delivery for a neonate is how much glucose is in whatever I am maintaining my neonate with. This is the formula to use. If your neonate is on an expressed breast milk, there is 7.1 grams in 100 ml of that breast milk. If your neonate is on a formula for a term neonate, who is on a normal formula for a term baby, there is still 7.1 grams per 100 ml of that formula. But if you have a preterm neonate who is on a preterm formula like a prenan, those tend to be sweeter than formulas for term babies. So there's usually 8.5 grams per 100 ml. If your neonate is strictly on neonatalite, neonatalite is a 10% solution. So it means in that solution, there is 10 grams per 100 ml. In a 12.5% solution, there is 12.5 grams per 100 ml. In a 15% solution, there is 15 grams per 100 ml. But remember, whatever you're going to get here is going to be in grams per days. So you also need to keep in mind that your glucose delivery units are in milligrams per kg per minute. So you have to keep in mind that whatever you calculate using these formulas that I've just given you is going to be in grams per day. And then you're going to need to convert those grams per day into milligrams per kg per minute. I'll tell you shortly how to go about that. So now let's try and do an example of a calculation using one of the cases that we were given on the previous video. So one of the cases was a day 1 term neonate who was 3 kg with no comorbidities. So let's assume, because that neonate had an asymptomatic hypoglycemia with an HGT of 2.2, let's assume that the neonate was started on feeds. So term neonate day 1, we start them at 60 ml per kg per day. So 60 times 3, it will give you 180 ml per day. So it means this neonate needs to be on 180 ml per day. So because neonates feed every 3 hours, that makes them feed 8 times in 24 hours. So if you want to calculate the exact feed, so you take that 180 ml, you divide it by 8, and you will get each feed per 3 hours. Okay, so this neonate was supposed to feed 22.5 ml every 3 hours, 8 times in 24 hours. Okay, so if this neonate was on express breast milk, we said the formula that we're going to use is 7.1. We said there's 7.1 grams in 100 ml of express breast milk. So that's the formula that you're going to use if you look at the other side of the calculation. And this particular neonate was actually getting 180 mils per day. Okay, so you solve for X. You try and find what the glucose was in that 180 mils per day that neonate was getting. So you solve for X and you cross multiply. X times 100 is going to be 100 mil X, and then 7.1 times 180 mils is going to be 1,278 grams dot mils per day. So because we're solving for X, we want to remain with only X, so you're going to divide by 100 on both sides. If you do that, you're going to be left with X is equal to 12.8 grams per day. So remember, your units of glucose delivery are in milligrams per kg per minute. So it means you need to convert that 12.8 grams per day into milligrams per kg per minute. So the first thing that you do, you convert grams into milligrams. So it means you multiply by 1,000. And therefore, whatever you get is going to be in milligrams per day. Then the next step, you look at your units. They are in per kg. So the next step is to divide by the weight of the patient, which is 3 kg. So now you're going to have units that are in milligrams per kg, but they are still per day. Now to convert days, you need to convert them into hours first by dividing by 24. So whatever you get from that initial calculation, you divide it by 24 to convert it into hours. And then after converting into hours, then you will convert it into minutes by dividing by 60. And if you do this right, you will get 4.2 milligrams per kg per minute. I know it sounds complicated while I'm explaining it, but once you get used to it, you actually do all the steps at once. So you cross multiply, and then whatever you get, you times 1,000, divide by weight, divide by 24, divide by 60, and then you get your answer in milligrams per kg per minute. So that's what we were giving in this neonate who was a term baby. And we said a normal glucose delivery for a term baby is between 4 to 6 milligrams per kg per minute. So it means we were actually delivering enough glucose on this particular neonate. So if this particular neonate is still having hypoglycemia while you are actually giving 4 milligrams per kg per minute at least, it means you're going to need to push him up to the upper limit, because we said it's 4 to 6. So you might need to adjust your fluids, push him to 90 mils per kg per day. And if you do that, if you calculate it the way I showed you how, you're actually going to get 6.2 milligrams per kg per minute if now you change your total intake to 90 mils per kg per day instead of 60. So that's how we calculate the glucose delivery. And it also depends if your neonate is also on fluids, let's say it's on fluids and feeds, you use different equations. If it's on neolite, you're going to use the 10 grams in 100 mil formula for neolite, and you calculate separately for fluids and you calculate separately for feeds, and at the end you put the total together to find the glucose delivery of this neonate, and then you make your adjustments after. So for those of you that find it difficult to calculate this glucose delivery manually, this is the formula or the equation that you can use. The problem about equations is that it's easy to forget them. It has to be in your pocket at all times. So it actually requires the very same things that I've mentioned already: the concentration per 100 ml, the infusion rate times the 1,000, you divide by weight, times 60, divide by the hour. It looks complicated, but it's just what I've just explained as you would do manually. The other thing, you can Google neonatal glucose delivery calculators. There's different calculators that you can use. You choose the one that you like. What they require of you is the exact same things that are here in this equation or that I've discussed already, which is the concentration, of whatever you're giving per 100 ml. If the child is feeding 7.1 grams per 100 ml, the weight, the rate, if it's your Neolite infusion. So they require those things, and then after that they automatically give you the glucose delivery. But I think it's important to keep that manual way so that when you don't have the calculators or the equations, you actually know how to calculate it at the top of your head. I hope this helps. The last thing that I would like to emphasize is that if your neonate is still having persistent hypoglycemias on a total intake that is a day ahead already. So let's say this neonate is already at 90 ml per kg per day on day 1. And as we've said, you were delivering adequate glucose delivery at least 6.2 milligrams per kg per minute. Now, if you're still experiencing persistent hypoglycemia, now you have no room of increasing your total intake because you have reached your limit for that day. So what you can do now is to concentrate your fluids. So if it's this term baby who was feeding, it's easy to concentrate things like IV fluids. So you can do something like half feeds and half IV fluids, half Neolite, and then you can concentrate your Neolite. Instead of being 10%, you can initially make it at least 12.5% and later 15%, depending on whether your neonate is responding. Remember, we've said we're using a peripheral line, you can go up to a 12.5% solution. If you go more than 12.5% solution, you're going to need to have this neonate to have a central line or a UVC, as high glucose concentrations can cause thrombophlebitis. So how do we make this concentration? How do we concentrate Neolite? The ratio is 10 mils to 100 mils. What is that 10 mil? That is 10 mils of 50% dextrose. So it means if you take 10 mils of 50% dextrose and you add it into 100 ml fluid, let's say you add it into 100 mils of normal saline, that 10 mils of 50% dextrose will make that normal saline a 5% dextrose saline. Okay, so if you do this to a Neolite, now a Neolite is not a 100 ml bag, it is a 200 ml bag. So if you want to increase the concentration of a Neolite to a 5%, it means you're not going to need 10 mils of 50% dextrose. Instead, you're going to need 20 mils of 50% dextrose, because we said the ratio is 10 is to 100 and Neolite is 200 mils. So it means you need 2 tens. You need 20 mils of 50% dextrose. If you add it into a Neolite 200 ml bag of Neolite, that will take that neonatal bag to 15% dextrose. But we don't want 15% initially, we want 12.5%. So it means if you take just 10 mils of 50% dextrose and you put it into a 200 ml bag of a neonatalite, instead of increasing that concentration now by 5%, it will increase it by 2.5, because your ratio is not 10 is to 100 in this case. Your ratio is 10 is to 200 ml bag. So it will increase it by 12.5 by 2.5%. So that's how we make a 12.5% neonatalite bag or a 15% neonatalite bag. And then you recalculate your glucose delivery according to the equations that I have given you. You calculate feeds separately, you calculate fluids separately, and then you add the total. That will be your glucose delivery.